In this video, we will address the question, why do endurance runners become injured? Endurance runners can become injured due to many reasons, but the most common would be overuse, which is any type of injury that is caused by repetitive trauma to a muscle or joint. Intrinsic factors that influence the rate of certain injuries include gender, race, genetics, muscle length, and muscle strength. Hyponatremia and hypoglycemia are other common factors that increase the risk factor for physical injuries. We have focused on 3 common injuries that endurance runners will face and found what physiological factors play a role in these injuries. Patellar tendonitis, shin splints, and plantar fasciitis have many similar physiological factors that can lead to overuse injuries.
Patellar tendonitis is an overuse injury that is characterized by tearing and inflammation of the patellar tendon. It's caused by repeated microtrauma to the patellar tendon due to a lack of recovery time. The patellar tendon is a single tendon attaching the quadriceps to the tibia. This is a common injury with endurance runners because runners repeatedly put stress on this tendon over and over again for a long distance in time. A muscular imbalance between the quadriceps and hamstrings can be a problem when the muscle development outpaces the adaptation and repair of the connective tissue. Connective tissue connects, supports, and binds other tissues or organs and includes tendons, ligaments, cartilage, adipose, and elastic tissue. There is a poor blood supply in this area, which means it needs a longer time to repair and recover because the nutrients will get there at a slower pace. If collagen loss exceeds new collagen gain, it is possible that the degree of deficit may have a correlation to connective tissue structural loss and lead to patellar tendonitis in endurance runners.
Medial tibial stress syndrome, also known as shin splints, are one of the most popular injuries for runners. This injury is caused by the overuse of the tibia and the connective tissue around it. This overuse feeling can come from a normal amount of running and training without the proper rest to allow for healing. A lack of rest is a common reason why endurance runners get hurt. Most athletes only feel the pain while running, and shortly after a rest period, the pain tends to subside. Unfortunately, there is nothing we can do to treat these issues. Doctors and athletic trainers will tell their athlete to ice, wrap, or take painkillers for the pain and swelling. There are some severe cases that the tibia is actually fractured.
Plantar fasciitis is also one of the most common injuries in athletes, including runners, dancers, and really any sport that involves a lot of running and jumping. The plantar fascia, as you can see here, is located at the bottom of the foot. It is a thick band of tissue that connects the heel to the toes. Plantar fascia supports the foot by providing a tension bridge as well as shock absorption. However, the fascia can only take so much pressure, and when the fascia fibers become damaged, the inflammation of the tissue can cause a lot of pain, including both soreness and stiffness. So the physiology behind this injury is mainly caused by the constant load and pressure on the fascia, and we would consider this to be a very common overuse injury. In order to prevent plantar fasciitis, purchasing a great pair of running shoes with proper support, depending on the athlete's foot, is important. Also, making sure to properly stretch before and after exercise. It is obvious that overuse injuries are the most common in endurance athletes. However, many of these athletes can experience exercise-associated collapse. EAC is a condition mostly caused by exhaustion, muscle cramps, and irregular body temperature. While running long distances, athletes must train properly and make sure they are fueling their body with enough nutrients and water to withstand such an event. Symptomatic hyponatremia, profound hypoglycemia, and exercise-induced hypothermia are likely to be encountered in long-distance races. Hypoglycemia is a condition caused by a very low level of blood sugar, the body's main energy source. Hyponatremia refers to a low level of sodium in the blood. Low sodium blood levels may result from excess fluid in the body relative to a normal amount of sodium, or it may be due to a loss of sodium in body fluid caused by a chronic condition like kidney or congestive heart failure. Current evidence is that all athletes with symptomatic hyponatremia are overhydrated by between 2 and 6 liters. Most collapsed athletes have rectal temperatures that either are within the normal post-exercise range of 38 to 41 degrees Celsius. The use of terms like heat exhaustion or heat strain are misleading, as the condition is clearly not the result of a failure of thermal regulation as is heat stroke, but must be caused by other mechanisms. 85% of athletes who collapse in association with prolonged exercise do so after the cessation of exercise. When closer to the finish line, the athlete's effort might persist, therefore depleting their limited anaerobic reserve capacity, muscle glycogen, blood glucose, or other fuel substrate to a level not previously experienced. Ultimately, a new level of fatigue is reached, pre-assembly accompanied by a reduction in the force-generating capacity of the muscle.
To answer the question, why do endurance runners become injured? Endurance performance is limited by injuries due to many reasons, with the most common being overuse, which we know is any injury that is caused by repetitive trauma to a muscle or joint. Overuse can often be caused by simply overtraining. The rate at which muscles, tendons, ligaments, and connective tissue are worked outpaces the healing process, which leads to injury. When runners overtrain, it can lead to muscle weakness and fatigue. Overtraining and overuse can also lead to hyponatremia and hypoglycemia, which are two conditions that can lead to increased risk of physical injury while running and can affect an endurance runner's overall health. We saw that when putting the body under large amounts of stress, it can lead to shin splints, patellar tendonitis, and plantar fasciitis. The best way to describe what physiologically can lead to these injuries and many others not talked about in this video is with overuse. There are many ways to prevent overuse, such as drinking enough water, eating a balanced diet, and training in the right conditions. Injuries are not something that endurance runners can avoid, but they can take measures to prevent them.